At 20 weeks gestation, I had a routine sonogram where they tell you the sex of the baby and things like that. And our OB doctors came back in after the sonogram and said, I couldn't quite see all 4 chambers of her heart. They finally came open and gave us the diagnosis of that our daughter had HLHS, or hypoplastic left heart syndrome. That was just kind of a moment that I just remember falling apart. And when I finally kind of got past that, then I went, okay, now what do we need to do? Hypoplastic left heart syndrome literally means that the left side of her heart didn't form properly. It was underdeveloped. After we kind of understood what that meant for her, we actually created a 3-page questionnaire for hospitals. And we would call, my mother-in-law did the legwork in it, but she called hospitals and would talk to their staff, ask the questions on our questionnaire, fill them out, and then send them to their responses to us on email. And we had hospitals that were close to us that would refuse to give us any information. They would refuse to tell us whether these complex surgeries had ever been performed in their hospitals, whether any surgeons had ever done them, what their success rates were. They just said, we don't have to release that to you. And because of their lack of releasing information, we basically said, well, then you're not a candidate for our hospital. We went through these questionnaires with several hospitals. We did research online to find out who the top hospitals were in cardiothoracic surgeries. And then once we were able to kind of gain that information, we kind of started ruling places out. We decided on Texas Children's Hospital. We met people that we talked to over the phone, or that my mother-in-law talked to over the phone, that were just able to really give us all the information that they wanted, or that we wanted, and even kind of go above and beyond that with, if they didn't know the answer right away, then they were able to get us that information so that we felt like we were getting all of our questions answered thoroughly. We wanted to give our daughter the best chance that we possibly can, and we wanted to make sure that we put her in the most capable hands to help her heart work to the best of its ability. There was one staff person that was in charge of people that come from out of state, and she made all the appointments for us. She came to each of our appointments, and when that appointment was over, she came and she walked us to the next place that we needed to be for whatever appointment. I think that really showed me the organization that's here, and for me, that made me feel comfort and peace. She was induced, and I was able to kiss her, and then they put her in the incubator and wheeled her off quickly. It was an 8-hour surgery. I was very relieved to get through the first one. I don't think that relief set in until I could actually see her and snuggle her and things like that. That one amazed me because it was a shorter surgery. Once she woke up from anesthesia and they were able to take her breathing tube out, it went so quick. Like, things just started coming out really fast, and I think it was just a couple of weeks that we were here for her second surgery. We come here about once every other year. We work with a cardiologist in Kansas. All of our records are sent here to Texas Children's Hospital so that people can monitor her and make sure that there isn't any kind of slight thing that might come up that they might be concerned about. Thank you for making it possible. Thank you for the support that I was given, even while I was here by myself. I had some nurses who were like, how long has it been since you've been out of this hospital, when I was rooming with my daughter, and them saying, you know what, it's really kind of slow right now. I'll sit in this room with her and I'll hold her while you go out and get a cup of coffee. I mean, it was just nice. since I was here by myself to have that kind of support. And those people that were looking out for me and my daughter. She looks like any other child. If you would meet her, she would talk to you, she would jump, she would play, she would run, and have no difficulties doing any of those tasks. In fact, her older siblings, I kind of joke that she can do anything they can do, but she tries to do it better.